Dr. Raj, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of the operating room. If you have back pain, listen to your body. Address it before it ruins your life with unnecessary aggressive treatments. I see this over and over again. People ignore back pain thinking back pain's normal. We as you as society think that, oh yeah, everyone has back pain. Not true. This country, we have an epidemic of back pain. 80% of Americans sustain back pain at one point in their life. Here's the problem. The rate of surgery for back pain is 5 times higher than the UK. This is absolutely ridiculous. I mean, we're taking something and making it into a huge ordeal. And the problem is we've got the media involved, we've got commercialism, we've got money involved. We have a society that is deconditioned, meaning that we don't exercise as much, we don't take care of ourselves, we're focused on work, we're focused on life, we're stressed out. Here's the problem. You keep on running down that realm, you'll end up having these unnecessary treatments and surgeries. You cannot ignore if you have an indicator for back pain. If you have a mild little pain, you have to address it. It's like anything. If you catch it early, it's not a problem. If you wait, I guarantee you, you'll walk down the pathway that multiple patients in my clinics walk down. There is a reason I do not do spine surgery. I think we are years, decades behind in terms of our technology. When you can offer 1,000 different treatments online or on billboards or on magazines for one entity, that means there's not one good treatment out there. Unlike a joint that has arthritis, we have a few good treatments. With back pain, you'll have everyone jump up and down and say, this is what we need to do. So too many people ignore these small little indicators of back pain, keep on working out. And this is classic amongst my weekend warriors. They will jump in, they'll feel like they're invincible, they'll have this minor back pain, they'll lift up weights and pop. And then they'll start their journey down the pathway of doctors' offices, unnecessary surgeries, and pain. I had a patient recently, and this guy is very dynamic. His name's Jason. I loved his energy. He was an agent for a company called CAA. He's 26 years old, young guy. He's always been athletic, but he has a very stressful job. He takes care of all these top actors and works 16 hours a day. So within that mindset, he thinks he's young, he thinks he's conditioned, but he's working 16 hours a day. He's eating horribly. And he started getting back pain about 3 months ago. And if you look at his posture, his back's rounded. And I talked to his girlfriend in the room, and the first thing she said, she noticed that his back started getting more and more rounded. You know, with that, he started getting generalized local pain, and he was walking with a porous stance and a porous posture. So he finally got an MRI, and the MRI showed some small disc bulge. I mean, we're talking 2 millimeters. So he went to one surgeon, and that surgeon said, I need to replace your disc. He went to a second surgeon, and that surgeon said, we need to fuse you. He went to a chiropractor, said, you need a multitude of adjustments. He went to an acupuncturist who said, you need acupuncture. He had actually, more than that, I can go on and on. He had about 6 different opinions. Finally, he came to me. And when he came in, It was the most horrendous posture. You could see the stress in his eyes. You could see cortisol, which is a stress hormone. If you could see it, it would be fuming around his ears and around his hair. He was so stressed. 26 years old. Do you think you want to ignore these symptoms? No, especially if you jump into my little world and you see what all of these things, all of these unnecessary treatments that were being offered to him. So with Jason, all I did was I said, try and stand up straight. He couldn't. He couldn't even put his back up against the wall and, lift up his arms and really show me a good posture without having pain. So I recommended aggressive physical therapy and strengthening of his back. Guess what? After the first week, everyone wants a quick fix. He came to me, he said, maybe I'll go for surgery from that second opinion. I said, I put a bet. I told him, I bet you, X number of whatever. I forgot what I bet, but it was a substantial bet. But I told him I wanted him to try physical therapy for 6 weeks, and I would guide it. 6 weeks later, he came in with the happiest look. He actually got a little taller, about 2 more inches taller. The point being is his pain was gone. On a minimal MRI of a 2-millimeter disc bulge, he would have gone one way, he would have had surgery. A second way, he would have had a disc surgery as a fusion. Third way, chiropractic, which could have worsened his disc bulge. Right now, there's a court case in Ventura, California, about one spine surgeon who had 17 lawsuits against him because he did all these unnecessary surgeries and fusions. You don't want to jump into that realm. This is not just Ventura. This is here. You need to take care of yourself. You need to listen to your body. If you have pain, address it. Number one, please don't ignore it. Number two, start off and use your common sense. As long as if you don't have aggressive numbness or tingling and the pains in your lower back, see someone. Many people are afraid of me, are afraid of the orthopedist or the surgeon. My recommendation is go see a orthopedic surgeon who doesn't specialize in spine surgery, such as myself, or a physical medicine and rehab doctor. That'll take out that bias of being pushed towards spine surgery, because now what we get is we get the smartest consumers who jump on the phone and say, spine problem, Google spine surgery. So they go to the spine surgery. 9 times out of 10, what's the spine surgery going to say? Is spine surgeon going to say, you need spine surgery? Absolutely crazy. I mean, it is biased. We know that there are a slew of unnecessary spine surgeries that are being done. There's a recent study in the Journal of Neurology, October 2013. They analyzed in a 1-year period 274 patients and deemed that 47 of them were offered unnecessary spine surgery. That's a rate of 17.4% in one subset. Now, if you go to different subsets with more aggressive tendencies, more aggressive surgeons who are incentivized, that number will be significantly higher. So I want you to take care of yourself. I want you to be careful, because this is not at the age of 26, in Jason's case, this is not a trek you want to go down to. Many of my weekend warriors, many of my patients who have this mild pain feel like that they're Superman, and they jump back and they say, I'll go higher in the weights and it'll go away. They say to themselves, no pain, no gain. You're absolutely wrong. You're putting yourself at so much risk. And who wants to live in a world of perpetual chronic back pain where you have to worry, how many feet can I walk before, or which way can I not turn, or who can I carry? Can I carry my 5-year-old? Can I Can I carry my 2-year-old? This is a life I don't want you to live. This is Dr. Raj at the Lifestyle Talk Radio Network. I'm talking about a very common issue, back pain, and how it affects all of us. Stay tuned when I talk about the multitude of treatments out there and the real treatments that may or may not help. This is Dr. Raj. You can contact me at drhipandknee.com. Thank you.
From helping florists manage their first payroll, to checking sales projections for logistics companies, to showing garages how much they've been paid, to pursuing leads for multinationals, Sage Software helps businesses manage. Whether it's accounting, payroll, payments, ERP, or CRM, Sage gives you the control to look forward with confidence. Visit sageconfidence.com.
When my daughter told me she was getting married this spring in Napa, my first thought was, to that guy? My second was, my allergies. That's when a friend told me about Advil Allergy. Turns out it's the only allergy medicine that relieves my itchy eyes and runny nose and has the speed and strength of Advil to tackle even my toughest allergy pain. So I could focus on the ceremony, not my allergies.
Fight even the toughest allergy symptoms with Advil Allergy, the only allergy medicine that comes with the speed and strength of Advil. Use as directed.
When my daughter told me she was getting married this spring in Napa, my first thought was, to that guy? My second was, my allergies. That's when a friend told me about Advil Allergy. Turns out it's the only allergy medicine that relieves my itchy eyes and runny nose and has the speed and strength of Advil to tackle even my toughest allergy pain. So I could focus on the ceremony, not my allergies.
Fight even the toughest allergy symptoms with Advil Allergy, the only allergy medicine that comes with the speed and strength of Advil. Use as directed.
Geico presents Strange Savings Stories. Sam Tucker woke to find crop circles in his cornfield that spelled out the word Geico. Was this a message sent by aliens? Sam went to Geico.com and saved hundreds of dollars with great discounts. He woke the next day to find new crop patterns had formed. They spelled out, "You the man." It seems the aliens were pleased indeed.
Geico. 15 minutes could save you 15% or more on car insurance.
Breathe it in, kid. Clean, fresh air thanks to these new air handler filters. They're more energy efficient, hold more dust, and are stronger than ever. And Grainger's got over 3,000 different styles and sizes to choose from. Just ordered a new batch from Grainger.com today. I love oxygen, kid. And this facility's got some grade A O2. I'm breathing easier just thinking about these air handler filters. Get some today. Get it? Got it? Good. Call, click Grainger.com/airhandler or stop by. Grainger, for the ones who get it done.
Staples has great deals on everything for your office break room. From coffees and teas.
Hey, boss, can I get some coffee?
No. To sports drinks and sodas.
Hey, boss, can I?
No. To chips and candy.
What if I...
No.
How
No. Staples has everything you need for your office break room.
But I'm gonna...
No. Except the break. Thousands of products added online every day. Even resume software. Now get a 20% off coupon for your K-Cup purchase. Staples. Make more happen.
Coupon valid 5/11 and 5/17/14 in store, online, or by phone. Limit 1 coupon per customer while supplies last.
The buyers at Lumber Liquidators just secured unheard-of deals direct from the mills on top-quality laminate and vinyl flooring for their laminate and vinyl flooring liquidation sale going on until this Tuesday. I'm talking over 80 different laminate floors on sale, 12 under 80 cents a square foot, including donor oak for just 49 cents. Get great deals on bamboo and hardwood flooring, too, like pre-finished solid red oak for just $2.59 and 10% off Morning Star bamboo. Go to lumberliquidators.com right now and find the store nearest you.
Geico presents Fan Mail to a Pig.
Dear Maxwell, I just want to say thank you for making my Geico Insurance ID card digital. It's easy to find on the app. It doesn't give me paper cuts, and I always have it on hand because it's on my phone. Because of this, I finally cleaned out my glove box, which was filled with years of paper ID cards. Any thought on what I should put in my glove box now? Sincerely, Trent Patterson. Trent, what can you put in the glove box? Here's a crazy thought. How about gloves?
Digital insurance ID cards, just a tap away on the Geico app.
This is Dr. Rod, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of that operating room. If you have back pain, listen to your body. Address it before it ruins your life with unnecessary aggressive treatments. There are so many treatments out there. You have to wonder when you have so many options. You look in any magazine, any journal, and it'll talk about this new traction system, this new ultrasound system, this new cream, all to treat one issue, back pain. You know why? 80% of Americans have back pain at some point in their lives, and it's a business. Commercial markets make it into a business. Why is it there's 5 times more surgery in the U.S. than there is in the UK for back issues per person? It doesn't make any sense. And then we also have a slew of failures, and I can vouch to that. I see them in the clinic. I see these young, healthy, once vibrant people coming in wheelchairs at the age of 40, depressed, with walkers, having complications after spine surgery, or after injections, or just deconditioned. It's horrible. I can't stand it. And the problem is this system is propagating itself because these people look for the next solution. And there's spine stimulators, which is supposed to take away your pain. There's pain management doctors who will cut nerves in your body to get rid of that pain. These are not solutions you want. The solutions you want are addressing the problem before it becomes a major problem, catching it early. You're young, you're healthy when this happens. If you have an initial indicator, don't turn your head towards it. Don't walk away. If you had bleeding in your stools, you'd address it. The same deal with back pain. Just because it's, you think this is normal to have back pain, or it'll go away. Wrong. Get it addressed. Look at what caused that little bit of back pain and correct it, because I do not want you walking through a system and a cycle of pain where you actually go back and forth to a different surgeon, different chiropractor, relying on medications, relying on surgeries. I had a patient recently in my clinic, and he's a very smart guy, and one thing he didn't like, his name's Mark, he's a 41-year-old producer in Hollywood, and he hated doctors, because his mindset was anytime he saw a doctor, it was always a negative experience. Anyone in his family has always ended up having surgery, and granted, you're right, doctors are never positive aspects in your life, usually. We're here to take care of problems. Well, Mark had an issue where he loved lifting weights and he loved doing deadlifts. And deadlifts are when you lift up the bar, keep your back straight, and then just lift up the weight, the plates on the bar. Now, it sounds simple, but if your back is any bit arched, then you're putting excessive force on that lumbar disc. I mean, to a point beyond belief. So what happened is Mark was doing his deadlifts, forgot about his posture, likely didn't do his stretching beforehand, and then pop. He had that pop that was, if you could hear it, was louder than anything he's ever heard in his lifetime, because it was associated with excruciating pain. He knew something horrible happened. At that time, he could have moved to the right, moved to the left. Many of you probably had a similar feeling like this. Mark immediately had numbness and tingling down his legs. Well, the first thing Mark did is said, I'm not going to see an orthopedic surgeon. Mark and I are now friends, so it's different. I'll tell you at the end. But Mark went to a chiropractor. Now, he has a pop, a disc likely pushing on a nerve, causing numbness down your legs. Wouldn't that scare you? Wouldn't that make you worried? That actually may, in my own rights, I mean, Mark just basically said, I'm going to have this dealt with a chiropractor. Went to see a chiropractor. Didn't do his research, just went to see one through recommendation of a friend. Chiropractor looked at him and said, you don't need a surgeon. You don't need a doctor. I'll take care of it. I see this all the time. Big smile on Mark's face. Well, he said, lie down, face down. So Mark's smiling, saying, the pain's going to be gone in a few minutes. I don't know what he's going to do, but this pain is going to be gone. Took his whole body and crack. Well, at that point, something devastating happened. Mark could not feel in his genitalia area, and he could not hold his urine. He had what's called cauda equina syndrome, meaning that when that disc gets big enough, and likely what happened in this scenario is that chiropractor propagated that disc, it pushes against the nerves that supply your bowel and bladder. You've got a small amount of time, hours, to get this addressed before it becomes a permanent issue. Well, Mark didn't address it right away. He waited 24 hours. 24 hours was 24 hours too long. Now Mark's wearing Depends. This is irreversible. He also has the back pain. Point being taken is, don't take these issues into your own hand. Don't be the surgeon. Don't be the doctor. When it comes to an issue like this, come and see a medical professional who can guide your treatment and guide it appropriately. In Mark's case, I would have gotten an MRI and I would have addressed that appropriately, and a chiropractor who would have seen the MRI would not have done that adjustment. And he would have likely had injections, traction, maybe even surgery. But the point being is, don't take your life into your own hand. It's a lot of responsibility. I want you to be healthy. I want you to be safe. And if you're not healthy and safe, I'm not happy, because I'm here to keep you out of the operating room whenever I can. This is Dr. Raj at the Lifestyle Talk Radio Network. I'm talking about back pain. Stay tuned when we talk about having a necessary surgery. I'm sure some of you know about this. You can contact me at drhipandknee.com. Thank you.
Buying a car can be a stressful experience. Well, TrueCar.com is changing car buying forever. Hey, it's Leah. TrueCar.com helps car buyers get rid of the fear they might overpay. Last month, over 45,000 cars were sold by the TrueCar Certified Dealer Network. And TrueCar users save an average of $3,046 off MSRP. So when you're ready to buy a car, just follow 3 easy steps. First, go to TrueCar.com and find out what other people paid for the car you're looking for. Then register at TrueCar.com to see upfront pricing information and to lock in your savings. And the third step is simple. Just print out your TrueCar savings certificate and take it to the TrueCar certified dealer for a better, hassle-free car buying experience. Every day, TrueCar users receive negotiation-free, guaranteed savings. Save time, save money, and never overpay. Visit TrueCar.com today. That's TrueCar.com.
They say every healthy relationship should have a balance of predictability and spontaneity. In fact, it is that assurance of security that makes the spontaneous possible. Your relationship with your car should be a little like that too. With our new industry-leading unlimited mileage warranty, your certified pre-owned Mercedes-Benz instills a sense of confidence. You drive away knowing that you can keep driving for up to 3 years and never have to worry about the miles. Add to that our new complimentary prepaid maintenance on select models, and your certified pre-owned Mercedes-Benz becomes the ultimate carefree escape vehicle. Only during the Mercedes-Benz Certified Pre-Owned Sales event, going on now through June 2nd, can you also take advantage of a 2-month payment credit on many models, plus 3 months of Sirius XM satellite radio. So hurry in today. It might just be the most predictable, spur-of-the-moment decision you've ever made.
See your authorized Mercedes-Benz dealer for complete details and limitations on certified pre-owned warranties.
There's a time bomb in your wallet. It's the 5+ credit cards you've been living on that you're barely able to make the minimum payments on. And when the time bomb goes off, it'll put you in a world of hurt. Here's the first sign your time bomb is about to go off. You can barely make your minimum payments. Here's the second sign. The interest rates on your credit cards are as high as 30%. Here's the third time bomb sign. You're getting collection calls and letters. Don't let the time bomb go off. Call the Debt Helpline today. Let us help you get out of credit card debt and turn off the time bomb.
800-515-6304. 800-515-6304. If you have $10,000 or more in debt, call now for your free analysis. 800-515-6304. 800-515-6304.
Geico presents Fan Mail to a Pig.
Dear Maxwell, I just want to say thank you for making my Geico Insurance ID card digital. It's easy to find on the app. It doesn't give me paper cuts, and I always have it on hand because it's on my phone. Because of this, I finally cleaned out my glove box, which was filled with years of paper ID cards. Any thought on what I should put in my glove box now? Sincerely, Trent Patterson. Trent, what can you put in the glove box? Here's a crazy thought. How about gloves?
Digital insurance ID cards, just a tap away on the Geico app.
Kid, if something in this facility breaks, bends, or bursts, Granger's got our back. 20 cases of disc springs from Granger.com, new rotary encoder ordered on Granger's mobile app, a dozen splash goggles from the local Granger branch. What more could you want in life? Granger has over 1 million products for all our facilities' needs. 1 million. That's a 1 followed by 6 zeros, kid. Everything we need whenever we need it. Get it? Got it? Good. Call, click Granger.com, or stop by. Granger, for the ones who get it done.
They say every healthy relationship should have a balance of predictability and spontaneity. In fact, it is that assurance of security that makes the spontaneous possible. Your relationship with your car should be a little like that too. With our new industry-leading unlimited mileage warranty, your certified pre-owned Mercedes-Benz instills a sense of confidence. You drive away knowing that you can keep driving for up to 3 years and never have to worry about the miles. Add to that our new complimentary prepaid maintenance on select models, and your certified pre-owned Mercedes-Benz becomes the ultimate carefree escape vehicle. Only during the Mercedes-Benz Certified Pre-Owned Sales event, going on now through June 2nd, can you also take advantage of a 2-month payment credit on many models, plus 3 months of Sirius XM satellite radio. So hurry in today. It might just be the most predictable, spur-of-the-moment decision you've ever made.
See your authorized Mercedes-Benz dealer for complete details and limitations on certified pre-owned warranties.
This is Dr. Raj, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of the operating room. If you have back pain, listen to your body. Address it before it ruins your life with unnecessary surgeries, treatments, don't end up in a wheelchair. Or as a statistic, we've got Todd on hold right now. Hey, Todd, where are you calling from?
Hi, Dr. Rose. I'm from Elgin, Illinois, outside Chicago.
Great. So how can I help you today?
Dr. Raj, I have been struggling with something for about 5 years. I'm a vet working under the VA system, which right now everybody knows isn't always the best. And I've been struggling. About 5 years ago, as I said, I was in a motorcycle accident that wasn't too severe for me, but the motorcycle had fallen on my foot in the midst of the accident, and I have been struggling with what is diagnosed with a neuropathy, something like that.
Okay.
And I have tried just about every type of physical therapy, inserts, and nothing seems to be working. And I'm a runner, or used to be a runner, and I can't run anymore because of the pain. And I'm at the point where I've heard that I could do the surgery, but it's not always the best thing to do. It's the last resort. I'm at the point now where I would be willing to have my foot amputated so that I could run again.
Wow, that is
it's just getting that bad. I want to run. I'm not healthy because I'm not able to exercise as well. And I'm just struggling with what to do next.
Well, where is this pain? Which area of your foot? Is it localized or is it all around your foot?
No, it's very localized. It's between my middle toe on my left foot, and it's like walking around with a rock in my foot all day long.
Okay, so it's between your two toes with numbness, tingling, and fullness, right?
No numbness and tingling, just very, depending on how long I've been on my feet for the day, just very sharp pain.
So, you know what? I commend you on two things. Number one, you know, the fact is doing your research and, you know, being open, not for an amputation, but for surgery. If you've got an issue like this and you've already got a neuroma that's there in between your toes, your best option and your option is definite option, being that your foot is a weight-bearing joint, is to have it taken care of. You know, you can't lose much by now, especially with the fact that you're in this constant discomfort and you can't run. And as you probably realize, the more weight you gain, the more of an issue this becomes. So my recommendation, without a doubt, is not the amputation, but is to get this neuroma removed.
So going ahead, trying to hopefully get the VA to accept that this is we're at the last resort, which is basically what? You go and remove, and I know it's really just a nerve that's being irritated. Somewhere along the way it broke. How did that happen? Did it break loose, or what is that about the neuroma that is what it is?
That's a great question. I mean, well, from your trauma, from your accident, what happened was the weight of the motorcycle struck your foot and basically induced an inflammatory response which formed scar around that little nerve. So it's that one little nerve that's causing all these problems. So simply removing it, the results are very good. So I would say go ahead and get this done and start running afterwards.
Great. I'm assuming, obviously, in removing part of the nerve, too, I'm assuming I lose a little bit of feeling.
You lose
probably not a whole lot.
But I guarantee it, you won't mind.
Yeah. Again, I'm willing to go without a foot. I appreciate I won't mind.
Okay, my friend. Good luck, and go for it.
Thank you very much.
Done. It's nice talking to you, Todd. So, getting back onto our topic, you know, spine surgeries. You know, there's an issue with spine surgeries in this country. I mean, spine surgeons are the highest paid surgeons in the country, number one. Why? Because we do 5 times more spine surgeries than the UK, than most of the world. So it's a business here. You've got implant companies. You've got all these people showing these new technologies, and people are jumping on and saying, you're jumping on and saying, I want to get this done. When you're in pain, you'll do anything. You know, Todd was mentioning about so bad he'd amputate his foot. If you presented 100 different treatments to him, he may jump at it. Once you're in pain, you're vulnerable. You need that. So I had a case recently of a patient of mine. His name is Mario, and he had a spine surgery done, basically 36 years old. He construction, and he just started having back pain from lifting. So he went to a spine surgeon, and the spine surgeon saw that he had multiple areas of involvement at 36. Didn't educate him much on the surgery, but told him, oh, yeah, your pain will go away. So Mario had basically a free-level fusion of his back. Now, for you, my audience, a fusion is a drastic procedure. It's when we take multiple levels of the spine, in this case, free levels, take out the disc completely, put in bone graft from your pelvis, and then put plates and screws in. At the age of 36, do you think that should be a first option? Absolutely not. And this is driving me crazy. I see this over and over and over again. When it puts tears to my eyes when I see a 36-year-old coming in with the complication of his complaints were to me, I still have back pain. And then I looked at him, I said, why did you have the surgery? Why? It's devastating because right now, what do? He went to, his recommendation from his surgeon a year after the fact is we can remove the hardware. I guarantee you removing the hardware is not the cause of that pain because that pain was never addressed. This is what I'm saying. This whole system's so commercialized. I mean, you'll have Google internet ads or even TV ads talking about the newest, latest, and greatest fusion device or screws or implants. Which country do you go to? Do you actually have that? Besides here, it's a commercial-based market. When people are in pain, when you're in pain, you will be open to any technologies out there with the hope that it takes away your pain. That's what's happening. I mean, this one surgeon up in Northern California who had 17 cases that's documented on, the LA Times recently, within a span of 17 months of practice where all of his hardware for his fusions loosened, meaning that anyone who came in, he recommended a fusion. Don't you think there's an issue there? I mean, where's the morality coming in? Where's the humanity coming in? Recommending a drastic operation and seeing a complication of this nature, well, I don't know if I could sleep at night if I were that surgeon who did this. I mean, the simple point is, back pain's so common it affects 80% of Americans at some point in their lives. That's a great business. 80% of us will be looking for a solution on Google. You'll be looking for a solution on TV. You'll be talking to people. The back pain will take you somewhere, and someone's going to have their sign out. I will get rid of your back pain. And the same level. Don't be that person. Don't be the person who jumps at these treatments. You need to take care of your own health, address an acute issue. If you have acute back pain, don't ignore it. Don't keep on lifting weights. Don't think you're Superman. Go see an orthopedist or a pain management or a family doctor who doesn't specialize in back surgeries or back procedures and get an honest opinion. Don't head down Mario's path. This is Dr. Raj at the Lifestyle Talk Radio Network. I am talking about horrendous stories around back pain. Stay tuned when we talk about ways to reverse your life and getting rid of back pain without even touching anything aggressive. These are simplistic tips. Thank you.
I looked out this morning and the sun was gone. Turned on some music to start my day. And lost myself in a familiar song. I closed my eyes and I slipped away.
There's a time bomb in your wallet. It's the 5+ credit cards you've been living on that you're barely able to make the minimum payments on. And when the time bomb goes off, it'll put you in a world of hurt. Here's the first sign your time bomb is about to go off. You can barely make your minimum payments. Here's the second sign. The interest rates on your credit cards are as high as 30%. Here's the third time bomb sign. You're getting collection calls and letters. Don't let the time bomb go off. Call the Debt Helpline today. Let us help you get out of credit card debt and turn off the time bomb.
800-515-6304. 800-515-6304. If you have $10,000 or more in debt, call now for your free analysis. 800-515-6304. 800-515-6304.
When my daughter told me she was getting married this spring in Napa, my first thought was, to that guy? My second was, my allergies. That's when a friend told me about Advil Allergy. Turns out it's the only allergy medicine that relieves my itchy eyes and runny nose and has the speed and strength of Advil to tackle even my toughest allergy pain. So I could focus on the ceremony, not my allergies.
Fight even the toughest allergy symptoms with Advil Allergy, the only allergy medicine that comes with the speed and strength of Advil. Use as directed.
When my daughter told me she was getting married this spring in Napa, my first thought was, to that guy? My second was, my allergies. That's when a friend told me about Advil Allergy. Turns out it's the only allergy medicine that relieves my itchy eyes and runny nose and has the speed and strength of Advil to tackle even my toughest allergy pain. So I could focus on the ceremony, not my allergies.
Fight even the toughest allergy symptoms with Advil Allergy, the only allergy medicine that comes with the speed and strength of Advil. Use as directed.
Breathe it in, kid. Clean, fresh air thanks to these new air handler filters. They're more energy efficient, hold more dust, and are stronger than ever. And Grainger's got over 3,000 different styles and sizes to choose from. Just ordered a new batch from Grainger.com today. I love oxygen, kid. And this facility's got some grade A O2. I'm breathing easier just thinking about these air handler filters. Get some today. Get it? Got it? Good. Call, click Grainger.com/air handler or stop by. Grainger, for the ones who get it done.
Buying a car can be a stressful experience. Well, TrueCar.com is changing car buying forever. Hey, it's Leah. TrueCar.com helps car buyers get rid of the fear they might overpay. Last month, over 45,000 cars were sold by the TrueCar Certified Dealer Network. And TrueCar users save an average of $3,046 off MSRP. So when you're ready to buy a car, just follow 3 easy steps. First, go to TrueCar.com and find out what other people paid for the car you're looking for. Then register at TrueCar.com to see upfront pricing information and to lock in your savings. And the third step is simple. Just print out your TrueCar savings certificate and take it to the TrueCar Certified Dealer for a better, hassle-free car buying experience. Every day, TrueCar users receive negotiation-free, guaranteed savings. Save time, save money, and never overpay. Visit TrueCar.com today. That's TrueCar.com.
From helping florists manage their first payroll, to checking sales projections for logistics companies, to showing garages how much they've been paid, to pursuing leads from multinationals, Sage Software helps businesses manage. Whether it's accounting, payroll, payments, ERP, or CRM, Sage gives you the control to look forward with confidence. Visit sageconfidence.com.
There's a time bomb in your wallet. It's the 5+ credit cards you've been living on that you're barely able to make the minimum payments on. And when the time bomb goes off, it'll put you in a world of hurt. Here's the first sign your time bomb is about to go off. You can barely make your minimum payments. Here's the second sign. The interest rates on your credit cards are as high as 30%. Here's the third time bomb sign. You're getting collection calls and letters. Don't let the time bomb go off. Call the Debt Helpline today. Let us help you get out of credit card debt and turn off the time bomb.
800-515-6304. 800-515-6304. If you have $10,000 or more in debt, call now for your free analysis. 800-515-6304. 800-515-6304.
This is Dr. Raj, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of the operating room. If you have back pain, listen to your body. Address it before it ruins your life with unnecessary, aggressive treatments. Don't end up in a wheelchair. Don't end up as a statistic. Take charge. You are in control. This is your world. You do not need to jump towards influences that are around us. I am looking on Wilshire Boulevard right now, seeing 2 back clinics with signs. Things are a little more, how should I put it, flashier here with signs, "We will cure your back pain." I'm just looking at these signs. It's absolutely crazy but people will line up, and these places are busy, and they do simplistic things as rubbing creams on your back or doing ultrasound, or they have got some non-FDA approved, self-approved treatment. Watch out. You're in charge. Go through logical steps. We'll go through the tips of solving and preventing your back pain after we talk to Michael, who's on hold. Hi, Michael. Where are you calling from?
Hey, doctor. I'm calling from Shreveport, Louisiana.
Great. So how can I help you today?
Well, I'm 48 years old, extremely active, athletic build, 200 pounds, 6'1", and every once in a while, my lower back, but I don't think it's the bones, but my lower back I'll get up in the morning and bam, I can't even tie my shoes. And it takes me 30, 45 minutes of, just easing it around, try to get it. And, I'm an animal trainer, and I run a nuisance wildlife control business, my own, so I can't stop. So I just push through. But I can't understand why it happens so intermittently when it's not anything I did.
Well, do you have any numbness or tingling down your legs with this, or just pain?
No, it's just pain, and it's like right across, I guess you call that lumbar area.
Okay.
Right through there. I do know I have some circulation issues. Sleeping at night, sometimes my hands and my arms, go numb and go to sleep. But changing position usually fixes that. But I have to wonder if it's something like I'm getting older. I watch my weight. Am I losing muscle instead of fat? I just don't know why it hits me intermittently.
Well,
I seem to be able to work it out.
When you are, it doesn't matter who you are. There's 2 aspects. Like our discs in between our vertebrae, they're under weight, they're under load. So at some point, like a cartilage in our knee or a cartilage in our hip, it's going to wear out slowly. And we all have that genetic aspect of some people's genetics are amazing in terms of when that disc starts desiccating or wearing out and starts bulging. And some people have horrible genetics. That's number 1. Number 2 is load. If you're a runner and athletic, that's great in the sense of, and I'm the biggest advocate, but you still put load on those discs as you run. So I would never say to anyone, don't run or don't load your discs. Just sit down and just save your discs. It doesn't make sense because we're And the opposite side, if you're not active, you'll load your disc more because of the weight you gain and the deconditioning. So it's a catch-22. But what I can tell you is at your age, right now, 48, being active, this is likely a disc issue in your lower back. And what happens is when you don't have to do anything, it just starts flaring up and starts getting more inflamed. The best thing you can do right now to address this, Michael, is to go see an orthopedist and just get an MRI of your lower back just to find out where you're at and what exactly is going on.
Well, I did that about 6 to 8 months ago because it was horrible, and they couldn't find anything. And they said it was muscular structural, they thought. Okay. But they didn't really give me, they put me through a full MRI, and they didn't find anything. But I'm going to tell you, when it hits, it doesn't hit very often. Literally, I can't, sitting down to, sit on a chair to tie my shoes.
Have you had any core strengthening or any...
No, interesting you should say that, because my wife said that I need to do Pilates. And I was like, yeah, right.
Yeah, see, going on to, what I'm saying is one of the biggest tips, one of the biggest things is no matter how healthy you are, if you got a weaker core, you're not protecting that spine. And that's one of the things you can do on a simplistic basis, now knowing you don't have any structural issues, to preserve your spine, is strengthen your core, strengthen your back muscles, do some isometric simple planks, and, get into a few Pilates type of classes, and AKA listen to your wife.
Yeah, she's going to love this, but seriously, you think that's the way to go?
Try it, and then call me back in about 6 weeks and tell me how you feel.
Okay, I'll do that.
It's nice talking to you, Michael.
Appreciate you, doctor.
So, that's one of the things, actually, that can preserve your back, help you. You need to have strong muscles around your back, core strengthening, Pilates. Number 2 is stretching. Number 3 is controlling your weight. The heavier you are, the more you'll load your back. And number 4 is external load. If you're 60 and you like powerlifting, and you've got a disc that's worn out, you may want to stop powerlifting and see what your actual gains are. You don't want to knock that disc out. By doing these simple activities, and also most importantly, following up with your family physician or your doctor just to rule out any structural causes, is a way you can prevent yourself from being a spine surgeon statistic. This is Dr. Raj at the Lifestyle Talk Radio Network, talking about back pain, how common it is, and how it is affecting all of your lives. I'm here to keep you out of the operating room and keep you safe in a simplistic way via education. Thank you for listening to the show today, and you can contact me at drhipandeknee.com. Thank you.